Welcome to Aging Untold. You've probably noticed telemedicine has become more widely used since the COVID-19 pandemic. Now more than 75% of U.S. hospitals offer remote care, up from 35% a decade ago. While it promises greater access to care and convenience, concerns around data security and insurance coverage remain. Amy, telemedicine is now part of the norm in healthcare. Is that a good thing?
Well, I don't think in terms of good and bad, so I'll give you the pros. And it solves a lot of problems. It solves problems for behaviorally challenged people that you can't get to the doctor. It solves the problem of someone needing to take time off work to get the person to the doctor. It solves the older person maybe in inclement weather, can't get to the physician. So I think in terms of where it can benefit, and I know my colleagues have other thoughts about it, but I would kind of filter who you're taking care of and when you can fit it in to make it easier for both the caregiver and the person.
I think it comes down to, again, the circumstance. So you're going to have the pros and the cons, and there's going to be a role for telemedicine. So if you're doing medical management or you're just trying to monitor the response to something that you did recently, you want to just a follow-up, I think that is great. It's not going to be a replacement or solution in terms of for a physical exam, because you get so much more of the complete picture with the patient when you have your hands on.
Oh, absolutely. Telemedicine's amazing until it becomes the substitute for what requires your hands, your eyes, and your ears. And so you've got to do real exams, and especially with our older people, you're going to miss so much more. It's so much easier for me to lie to you over a phone or over a screen than it is if you're looking at me and you can see physical changes and you can see that body change or whatever's going on. I tell all of our older people, get your feet looked at your doctor's visits, because that's your foundation. Are the telemedicine doctors doing that? I think it's great for med refills, lab results, things like that. But shortness of breath, how are you going to examine somebody that's saying, I'm having a little shortness of breath? Okay, well, here, we'll send you an inhaler. Yeah. What about a lump? Are you going to find a lump on somebody? Your doctors need to touch.
Yeah, I wouldn't use it as my annual follow-up.
Right.
The annual follow-up, but if you already are monitoring something very short-term or lab results, that's excellent to go over lab results. Or I just started you on a blood pressure medication. If they're having home blood pressures, okay, or any kind of other medication, something I'm monitoring, very short-term.
But even at home blood pressures, are they taking them?
It depends on who's taking it.
Yeah.
And sometimes the
And what
auto
machine?
machines are not as accurate as
and
the
what
manual
machine
ones.
they're
So
using.
it really depends on really what you're managing.
Yeah.
I think mental health is really good for mental health follow-up.
I completely agree with mental health.
And have that, belly-to-belly conversation, being seen eye to eye, and physical touch, just feeling like a little more cared for. But sometimes there is a professional caregiver in the home helping manage that telemedicine visit. So it can be very convenient for people, and their whole day isn't disrupted for something that's routine. But you do have to supervise your loved ones and make sure that they're getting face-to-face with the doctor when it's really important to do so.
And they're actually expressing those concerns. They're actually talking about what's real instead of, oh, no, I feel fine.
Well, that's why it's important to have, again, someone else there. I think the other ears and eyes
Right.
to say, no, that's not what's,
Right.
be able to fill in the gaps.
I agree. I think the hybrid approach is what we're all kind of recommending, that you have both. I was also thinking about people that want to go on vacation and bring their parent with them. And if they had a follow-up, they could just call and check in and not have to not go to a nephew's house or a grandchild's house because of a check-in with a doctor.
Right. I was really surprised. I didn't realize that the VA actually uses Zoom and telehealth. I was like, wow.
Great piece of
It
information.
became a huge thing during COVID, and because we couldn't go out, we couldn't be seen, and then you didn't want to take your aged loved ones, especially into any doctor's office and expose them. So it became a huge thing then, and I think, unfortunately, the convenience, it's no different than everything else that becomes convenient. It takes over. And I still think that the human touch and going to the doctor and having them physically touch and put their hands on and feel your lymph nodes and feel those things is real important.
And the reimbursement actually may be lower too for some.
Oh, yeah, from a
Interesting.
physician side.
Interesting.
Yeah, I hadn't thought about that part.
Well, I think it's really interesting that older adults are the biggest users in telemedicine. And it does make it easier on the caregiver and just, can take some pressure off, but you really don't want to defer those physical face-to-face appointments.